Welcome to my YouTube channel, Lymphatic Medical. Today's video, we shall be looking at the gross anatomy or the anatomy of the pancreas. The pancreas is a dual functional organ. For the fact, it's a gland, right? It's a dual functional organ. Before we proceed, if you're coming across my channel at the first time, if you are coming across my channel at the first time, do not forget to subscribe, like, comment, and share our video. It's so essential so that other students can benefit from the awesomeness of the channel and all that. Now, let's dive into the class. This is the diagram that we shall be using to discuss everything that we shall be talking about on the pancreatic anatomy. This diagram here depicts the location of the pancreas. This depicts the parts of the pancreas. This is the venous range of the pancreas. This is the arterial supply of the pancreas, while this is the pancreatic duct, right? The first thing is introduction. What is pancreas? Pancreas is a soft, finely lobular, elongated exoendocrine gland. That is the concept of pancreas. It is a soft, finely elongated, lobular exoendocrine gland. The exocrine portion of the pancreas is responsible for the production or the synthesis of pancreatic secretion. That is why in the pancreas is mainly being formed by the exocrine component. The bulk of the pancreas is composed of the exocrine component, while the endocrine component of the pancreas is concerned with the secretion of the hormones, which maintains glucose homeostasis in the body, right? That is why the pancreas is a dual functional organ. It is a gland because it's secretory in nature. It is dual in nature because it has an exocrine part, which is responsible for the secretion of the pancreatic juice, which contains the pancreatic enzymes that digest lipid, carbohydrate, and protein. Whereas its endocrine part is concerned with the secretion of hormones, which maintains glucose metabolism. And that is the concept of the pancreas being a dual functional organ, right? The next outline we shall be looking on to is the location. Where is pancreas located? Pancreas lies more or less horizontally on the posterior abdomen within the epigastric and left hypochondriac region. The pancreas crosses the posterior abdominal wall obliquely from the concavity of the duodenum to the splenic hilum, or to the hilum of the spleen, where it lies opposite or anteriorly to the vertebral level, ranging from the T12 to L3, right? Now you can see this is the concavity of the duodenum, right? This is the duodenum. Duodenum, right? This is the concavity of the duodenum. So you can see that the pancreas crosses the posterior abdominal wall obliquely from the concavity of the duodenum to the hilum of the spleen, or the splenic hilum, opposite or anteriorly to the vertebral level of T12 to L3, right? So this is the hilum of the spleen. Hilum of spleen. This is T12, L1, L2, and L3, right? Now, as you can see, it lies what? Obliquely, right? On the posterior abdominal wall. The greater part of the pancreas is purely retroperitoneal. It is purely retroperitoneal in nature. And this greater part of the pancreas is composed of the head, the neck, and the body, right? Where it lies behind the serous floor of the lesser sac of the peritoneum. While its left extremity, which is the tail, is purely intraperitoneal in nature, where it lies in the linorenal ligament along with the splenic vessel, right? Linorenal ligament. So this is the spleen already, right? This is our IVC. This is abdominal aorta. This is our abdominal aorta. So this is how the spleen is located on the posterior abdominal wall. But you have to understand that the spleen is located deeply on the upper aspect of the abdomen, where it is hidden by many organs. Hence, the pancreas, not the spleen. The pancreas is located deeply on the upper part of the abdomen, where it is hidden by many organs. Hence, it is not visibly accessible during physical assessment, right? You can't assess pancreas on physical assessment because it is located deeply on the posterior abdominal wall, right? So, this is how the pancreas is situated on the abdomen, right? Where it lies opposite to the vertebral level of T12 to L3. This is the vertical extent of the pancreas according to the vertebra, right? So that is all about the location. The next is shape and size. The next is the shape and the size. Now, yes, is an organ, is a structure, is a gland, it will have a shape. The pancreas is jet-shaped or retard-shaped when placed obliquely or when set obliquely. So it is jet-shaped or retard shaped when placed obliquely, right? Now, on the size, the pancreas, the length of the pancreas is usually from 12 to 15 cm in the length. Length is 12 to 15 cm. Now, on the weight, it usually weighs 80 to 90 gram. That is the weight of the pancreas. Now, the width of the pancreas is usually 3 to 4 cm, right? This is the width. So these are the sizes of the pancreas, ranging from the length to the weight and also the width, right? So we have discussed the shape and size of the pancreas. The next we shall be discussing is the parts of the pancreas. The parts of the pancreas. The parts. The pancreas is divided into 4 parts. We have the head, the neck, the body, and the tail. For that, this is the tail of the pancreas because it has to continue with the hilum of the spleen as it is lying obliquely on the posterior abdominal wall. So this is the tail of the pancreas. right? Cell of the pancreas. So these are the parts of the pancreas. The head has one process which is called uncinate process, while the body has also a process called the tube omental, right? So this diagram depicts the part of the pancreas. This is the head. This is the neck. This is the body, while this is the tail, right? Now, the head has a process called uncinate process. Here is the uncinate process. Uncinate process. While the body has a process also called the tube omental. So this is how their processes are fashioned. Let's quickly look at the head. Let's look at the head, right? The head of the pancreas is the large C-shaped right end of the pancreas. You can see it is large, right? Watch here. Let's use this to describe how it goes. So the head of the pancreas, which is this, the head of the pancreas is a large C-shaped or disc-like shape. It is a large disc-shaped right end of the pancreas, which lies on the concavity of the C-shaped duodenal lobe in front of the L2 vertebra. You can see it lies in front of the L2 vertebra. Look at it here. The head lies in front of the L2 vertebra. Now, you can see that it occupies the concavity of the duodenum, right? It occupies the concavity of the duodenum. That is why it is a large disc-shaped right end of the pancreas, because this is the right aspect, while this is the left aspect of the pancreas. So it is a large disc-shaped right end of the pancreas, which lies on the concavity of the C-shaped duodenal lobe in front of the L2 vertebra. So the L2 vertebra is actually the vertical landmark according to the vertebral level of the head of the pancreas, right? Now let's quickly discuss the external features of the head of the pancreas. The external features. It has two borders and it has three borders and two surfaces. Borders and surfaces. On the area of the borders, we have superior border, right lateral border, this is right, and we have inferior border also. On the area of the surfaces, we have anterior surface and posterior surface, right? Now let's quickly look at the borders. The superior border. The superior border of the pancreas, because we shall be discussing these borders and surfaces according to the relation, the structures they relate to. That is what the features, that is the external features is all about. So let's quickly discuss the relations of these borders and surfaces. Now, the superior relation of the head of the pancreas is related to the what? To the first part of the duodenum. To the first part of the duodenum and also to the superior pancreatico duodenal artery. Right? So this is the first part of the duodenum. First part, second part, and third part, so that you understand it better. So that means this is the superior border of the head of the pancreas, which is related with the first part of the duodenum, and also with the superior pancreaticoduodenal artery. While the right lateral border of the head of the pancreas is related to an important region. It is related to the, look at it here. It is related to the second part of the duodenum and also to the anterior and posterior pancreaticoduodenal arteria arcadae, right? Arcadae, arteria arcadae. Right? Look at it here. So the inferior border of the head of the pancreas is related to the third part of the duodenum and also to the inferior pancreaticoduodenal artery. So those are the relations of the borders of the head of the pancreas, right? Those are their relation. Let's quickly move to the surfaces. We have the anterior surface and posterior surface. What are those structures that are related to the anterior and posterior surface of the head of the pancreas? The anterior surface of the head of the pancreas is related to the gastroduodenal artery, also related to the transverse colon, also related to the root of the transverse mesocolon, and also the jejunum. While the posterior surface is related to the IVC, which is this, is also related to the left renal vein, is also related to the bile duct, is also related to the left crux of the diaphragm, right? So those are how the head of the pancreas is being fashioned. But the remaining one, which is the uncinate process, the uncinate process on this region. The uncinate process, you can see, because the head has an uncinate process. The uncinate process of the head of the pancreas is usually appear like a hook-like process, which is directed downward and towards the left. It's directed downward and towards the left aspect. It is also to be directed towards the left, where it lies in relation to the superior mesenteric vessels, right? Now, what are the relation of the uncinate process? It has anterior relation and posterior relation. On its posterior relation, it is related to the abdominal aorta, while the anterior relation, it is related to the superior mesenteric vessels because it lies towards the superior mesenteric vessels, right? Those vessels transverses it diagonal on this aspect, right? So the anterior relation related to the superior mesenteric vessel, while the posterior relation is related to the abdominal aorta. So that is all about the uncinate process. It is a hook-like process which is directed downward and to the left from the head of the pancreas, right? Now let's quickly look at the neck of the pancreas. The neck of the pancreas. This is the neck of the pancreas, right? The neck of the pancreas is the constricted region of the pancreas. It is the constricted region of the pancreas which is found between the head and the body of the pancreas, because this is the body, this is the head, right? So the neck of the pancreas is the constricted region of the part of the pancreas which is situated or found between the head and the body of the pancreas, right? This neck of the pancreas has external features where we have the anterior surface and posterior surface and upper and lower border. So borders and surfaces. It has anterior surface, posterior surface. This, it has upper and lower border. Upper and lower border. U is for upper, while L is for lower, right? So the surface of the neck of the pancreas, its anterior surface is related to the pylorus of the stomach, right? While its posterior surface is related to the commencement of the portal vein. This is the portal vein, right? So these are how their relation is fashioned. Now let's go to the borders. The upper and lower border of the neck of the pancreas, right? The upper border of the neck of the pancreas, right? Now it has upper border and the lower border. The upper border is related to the first part of the duodenum, right? You can see it here. This is the neck region of the pancreas. This is the neck region. This is the neck region of the pancreas. So the upper border, which is the superior border, is related to the first part of the duodenum, while the lower border is related to the root of the transverse mesocolon, right? To the root of the transverse mesocolon. Now you have to understand that the neck of the pancreas is usually directed upward, forward, and to the left. You can see is what directed upward, forward, and to the left, right? So that is how it is being fashioned, and it is being measured 2.5 cm, right? In length, 2.5 cm, yeah, 2.5 cm. So that is all about the borders and the surfaces of the neck of the pancreas. Let's quickly look at the body. The body. This is the body. The body of the pancreas. The body of the pancreas is an elongated part of the pancreas. Is an elongated part of the pancreas, which is found or situated between the neck and the tail of the pancreas. You can see how I partition it so that you understand it better. The head, the neck, the body, and the tail, right? So the body of the pancreas is what? Is the elongated portion of the pancreas, which is situated between the tail of the pancreas and the neck of the pancreas. It has three borders, three surfaces, and also an uncinate process, which is and also a process, not uncinate process. The uncinate process is particularly for the head of the pancreas. It has a process called the tube omental. The tube omental is actually the part of the body of the pancreas which projects above the lesser curvature of the stomach. It projects above the lesser curvature of the stomach, right, towards the lesser omentum, which crosses the lesser sac of the peritoneum. So that is how the process of the body of the pancreas is fashioned, which is the tube omental. Now let's quickly look at the surfaces and the borders. On the area of borders and surfaces, it has anterior border, superior border, and inferior border. On the surface, it has anterior surface, posterior surface, and inferior surface. So this is how their borders and surfaces are being fashioned. Now let's quickly look at the relation to these borders because it's so essential, right? The anterior border usually provides site of attachment of the transverse mesocolon, right? The root of the transverse mesocolon. So the superior border is related to the celiac trunk, while the inferior border is related to the superior mesenteric vessels, right? That is how it works on the borders. The anterior border provides site of attachment of the root of the transverse mesocolon, while the superior border related to the celiac trunk mainly, while the inferior border is related to the superior mesenteric vessels, right? Now, the surfaces, you have anterior surface, posterior surface, and also the inferior surface. The surfaces, we have the anterior surface, posterior surface, and the inferior surface. The anterior surface is usually concave, where is directed forward and upward, right? It is related to the lesser sac of the peritoneum and also to the stomach. While the posterior surface is related to the aorta and the origin of the superior mesenteric vessel. It is also related to the left kidney and the left suprarenal gland. It is also related to the splenic vein, right? Which courses along the splenic artery. So that is how the relation of the surfaces of the body of the pancreas is fashioned, right? Now, the inferior surface, right, is related to the duodenojejunal flexure, and also is also related to the left colic flexure and also the coils of the jejunum. That is the three relation of the inferior surface of the body of the pancreas. So we have discussed these borders and the surfaces, right? Let's quickly look at the tail. The tail, which is here. Recall that I said previously, before I go to the tail, that the tube omental is the process of the body of the pancreas, right? Which projects above the lesser curvature of the stomach, where it comes in contact with the lesser omentum across the lesser sac of the peritoneum, right? However, the body of the pancreas is usually lie in front of the vertebral column or just below the Addison's plane or the transpyloric plane, right, of the abdomen. So that is how they have been fashioned. Now, let's quickly look at the tail. The tail, right? The tail of the pancreas is actually quite different from the other part of the pancreas, which is the body, the neck, and the head. The head, the neck, and the body is purely retroperitoneal, while the tail is an intraperitoneal region, right? Which is lying in the linorenal ligament along with the splenic vessels. I've said it previously, the linorenal ligament, right? So the tail of the pancreas is a narrow left extremity of the pancreas. It is the narrow left extremity. You can see it is found on the left aspect because the pancreas is on this manner on the posterior abdominal wall, right? So it is the narrow left extremity of the part of the pancreas, right? Which lie in the linorenal ligament along with the splenic vessel. Now, the relation of the tail of the pancreas is in accordance with the visceral relation of the spleen between the gastric impression and the colic impression. So if you want to discuss the relation of the tail of the pancreas is in accordance with the visceral relation of the spleen between the gastric and colic impression. So that is how it works. Recall that the tail of the pancreas is made up of the bulk of the islets of Langerhans in the tissue of the pancreas compared to other parts. So that is to say that you have more bulk of eyes length of Langerhans, right, in the tail of the pancreas compared to other parts of the pancreas, which is the body, the neck, and the head. So if anything should happen to this region is mostly concerned with the secretion of hormones, that is the islet of Langerhans, those islet cells, right? The alpha cells, the beta cells, the delta cells, and all that. So that is how it works. So we are done from the part of the pancreas. Let's quickly discuss the ducts of the pancreas, the pancreatic ducts. Now, this is the diagram depicting the pancreatic duct, right? Now, the pancreatic duct is so essential for digestion in the duodenum, right? So we have two pancreatic ducts. We have the main pancreatic duct, which can be called the duct of Wasson, and also the accessory pancreatic duct, which can be called the duct of Santoroni. So this is the main pancreatic duct, which can be called the duct of Wasson. Duct of Wasson. We have the accessory pancreatic duct, which can be called the duct of Santoroni. We also have the bile duct. Now, the duct of the pancreas are responsible for the drainage of the exocrine secretion of the pancreas into the duodenum, which helps in the digestion of the lipid, carbohydrate, and protein. That is what the exocrine component of the pancreas does, because it contains the pancreatic juice. It secretes the pancreatic juice, which contains the pancreatic enzymes, such as the proteolytic enzyme, the amylotic enzyme, and also the lipolytic enzyme. We have the proteolytic enzyme, this proteolytic is for protein, which break down protein. Amylotic is for carbohydrate, while lipolytic is for lipid. So the pancreatic juice contains these three classes of enzymes which digest protein, carbohydrate, and lipid, right? So let's quickly discuss the main pancreatic duct. The main pancreatic duct begins from the tail of the pancreas. You can see this is the tail. It begins from the tail of the pancreas, where it transverses the whole length of the pancreas. It transverses the whole length of the pancreas near to the posterior surface of the pancreas. At the level of the neck of the pancreas, it descends downward, medial, where it enters the second part of the duodenum, right? At the level of the second part of the duodenum, it joins with the bile duct to form the hepatopancreatic ampulla ovata. which opens into a narrow opening called the major duodenal papilla, right? So this is the major duodenal papilla, major duodenal papilla, while here this is the hepatopancreatic ampulla of Vater. Hepatopancreatic ampulla of Vater. Now, the pancreatic secretion into the duodenum through the major duodenal papilla is regulated by a sphincter called the sphincter of Oddi. The sphincter of Oddi is here, is inside this major duodenal papilla. It's a sphincter which regulates the influx of pancreatic secretion into the duodenum to aid in digestion, right? So recall that they still have other tributaries or small dots along the length of the pancreas. All these things are small dots. They are small dots, right? The smaller dots. So that is how it works. As it transverses along the entire length of the pancreas, at the level of the neck of the pancreas, it descends downward medially to enter the second part of the duodenum. At the level of that second part of the duodenum, it joins or unites with the bile duct to form the hepatopancreatic ampulla of Vater, which opens into a narrow opening called the major duodenal papilla, right? That is how they are being fashioned. Now, the accessory pancreatic duct, which can be called the duct of Wasson, how does it work? It begins from the lower part of the head of the pancreas. The lower part of the head of the pancreas, where it ascends up. It ascends up medially and crosses the main pancreatic duct to open into the what? Second part of the duodenum as well, where it pierces it, right? To open it by the minor duodenal papilla. The minor duodenal papilla. Minor duodenal papilla, right? So the pancreatic secretion enters the duodenum through the minor duodenal papilla or the major duodenal papilla, right? Recall that this one has a sphincter called the sphincter of Oddi. The sphincter of Oddi is here, is inside this minor duodenal and major duodenal papilla. Sphincter of Oddi. Sphincter of Oddi, right? This is the sphincter of Oddi, which regulates the influx of the pancreatic secretion into the what? The duodenum to aid in digestion. So this remains the duodenum. So that is how it works. That is the pancreatic duct. How it aids in digestion by emptying the pancreatic secretion into the duodenum, right? So we have duct of Wasson is there. We have duct of What of Santorini? So the next outline we shall be looking on to is the blood supply or the arterial supply. The blood supply of the pancreas is so much essential because since the pancreas develop between the foregut and the midgut, that means it has a blood supply from the foregut, which is the celiac trunk, and also the blood supply from the midgut, which is the branches of the superior mesenteric artery, right? So this is the celiac trunk. This is the celiac trunk, right? This is the left gastric artery. We don't need it. It's for stomach. So this is the hepatic artery. Hepatic artery, right? Now this is the superior mesenteric artery. Superior mesenteric artery. That is why the major arterial stem that supplies to the pancreas is the hepatic, the branches coming from the hepatic artery and the superior mesenteric artery, and also the branches from the splenic artery, because this is the splenic artery. This is the splenic artery. This is our spleen. Now, there is an artery here called the gastroduodenal artery, which give rise to the superior pancreaticoduodenal artery. Look at it here. Superior pancreaticoduodenal artery. Now, this artery forms the anterior pancreaticoduodenal artery also, which is here. Anterior pancreaticoduodenal artery. The superior mesenteric artery gives us a branch which is called the inferior pancreaticoduodenal artery. Look at it here. The inferior pancreaticoduodenal artery. The inferior pancreaticoduodenal artery gives off a branch which is called the posterior pancreaticoduodenal artery. Now watch. The branches from the both superior pancreaticoduodenal artery and the inferior pancreaticoduodenal artery forms anterior and posterior branch, which is between the convexity of the ureter, the concavity of the duodenum. That is the head of the pancreas region, right? Which is the head of the pancreas region. They form anterior and posterior branch. The anterior and posterior branch of the superior pancreaticoduodenal artery and the inferior one forms an anastomosis. The anastomose to form the anterior and posterior pancreaticoduodenal arteria arcadae, right? Which is what I've said previously here. Arteria arcadae is formed between the anterior and posterior branches from the superior pancreaticoduodenal artery and inferior pancreaticoduodenal artery. Because the anterior and posterior branch actually anastomosis to form the anterior and posterior pancreaticoduodenal arteria arcadae, right? They forms it on this region. This is the point of the anastomosis, which is the posterior pancreaticoduodenal artery and anterior pancreaticoduodenal duodenal artery, right? So we still have what we call the pancreatic branches, which is on this region. The pancreatic branches. We still have what we call arteria chordae pancreatica. Look at it here. Arteria chordae pancreatica, and also arteria pancreatica magna. Look at it here. Arteria pancreatica magna. All these things are arteries that supplies to the pancreas, right? Coming from the splenic artery, which is a direct branch of the celiac trunk. Because as I said previously that this is the gastric artery, left gastric artery is not needed there. So that was why I didn't have to label it, right? So this is the arterial architecture of the pancreas, right? Providing strong perfusion to the pancreas, right? Let's quickly look at the venous drainage or the venous supply. The venous supply to the pancreas is similar to the arterial supply, but there are differences, right? Now watch. The venous supply is mostly from the portal vein. The portal vein, the superior mesenteric vein, and the splenic vein. So this is the portal vein. This is the superior mesenteric vein. Superior mesenteric vein. This is the splenic vein, right? Why this is the superior pancreaticoduodenal vein, superior pancreaticoduodenal vein. This is inferior pancreaticoduodenal vein. Why here is we call it the venous pancreatic. This is the vena pancreatica magna. Vena pancreatica magna. So all these things, all these veins supply to the, like the drains on the pancreas, right? This is explained, right? So the next outline we shall be discussing is the lymphatic drainage. The lymphatic drainage. The lymphatic drainage of the pancreas is actually four, right? We have the pancreatico-splenic node, which is the main lymphatic node of the pancreas. We have the pyloric node. We have the celiac node. We also have the superior mesenteric node, right? So those are the lymphatic drainage of the pancreas, right? Let's go to the nerve supply. The nerve supply. The nerve supply. Pancreas is both sympathetic and parasympathetic. And the nerve innervations of the pancreas is derived from the celiac and superior mesenteric plexus, right? So it is both sympathetic and parasympathetic. Now, the sympathetic nerve innervation of the pancreas is purely vasomotor. Why the parasympathetic is concerned with the pancreatic secretion, right? So that is how it works. That is the nerve innervation system of the pancreas. The last but not the least is the clinical correlation. The clinical correlation. Clinical correlation. Clinical correlation. We have number one, carcinoma of the head of the pancreas. That is the most common. The carcinoma of the head of the pancreas. Carcinoma of the head of the pancreas. Carcinoma of the head of the pancreas is the most common cancer of the pancreas, right? Because it mostly occur when there is compression of the head of the pancreas, thereby leading to obstruction of the bile duct, which might cause obstructive what jaundice or persistent obstructive jaundice, right? Because of the bile. So this is the most common cancer of the pancreas, which is what carcinoma of the head of the pancreas. The next is the acute pancreatitis. Acute pancreatitis is simply the acute inflammation of the pancreas, right? The acute inflammation of the pancreas. Mostly being caused as a result of also the obstruction of the bile duct also, though it has so many etiologies, but that is the most common one. So we have done justice to the pancreas anatomy, ranging from the introduction to the clinical correlation. I believe you enjoy the class. Thank you so much for staying to the end of this class. Endeavor to share the video, subscribe, and comment. Thank you so much.